Now let's talk about forceps and vacuum. Forceps and vacuum are two different kinds of tools that have been used to assist vaginal deliveries, meaning that they are used in vaginal births for different purposes, often to expedite delivery. Here are a few steps that you can take to avoid your risk of receiving these. First is to birth in an upright position. The second is to avoid the use of an epidural or a spinal block. Also, hiring a doula to be at your birth decreases the risk of forceps and vacuum. And hiring a midwife as your care provider decreases your risk as well. First, let's talk about forceps. If the person is pushing and the baby is not tolerating labor well, they may benefit from forceps delivery. Forceps kind of look like salad tongs. They're tools that are inserted into the vagina and they go along each side of the baby's head. Then the care provider pulls and guides the baby out with the efforts of the person pushing. The benefits is that it may expedite delivery in the case of a true emergency. Forceps may manually turn the baby if the baby is not turning in the position that they need to be in to be delivered. During a medical emergency, forceps allow the person birthing to have a vaginal birth rather than a cesarean birth. Now let's talk about the risks. Pelvic floor dysfunction, including urinary and fecal incontinence, pain with sex, increased risk for episiotomy, increased risk for vaginal tearing, increased experience of pain during the procedure, feelings of distress or trauma. The risks to the baby include swelling to the baby's head, known as cephalohematoma, marks that are left on the baby's head from the forceps, which often resolve, shoulder dystocia, which is when the shoulders get stuck, bone and skull fractures, internal bleeding or intracranial hematoma, seizures, and brain damage. Now let's talk about vacuum. The use of vacuum may have decreased risks of trauma to the person birthing in comparison to forceps. They may expedite delivery in the presence of an emergency. During an emergency, vacuum can allow the person birthing to have a vaginal birth rather than a cesarean birth. And the person birthing may feel relief that a long labor is over and the baby came here vaginally and a cesarean wasn't required. The risks to the birth parent include feelings of distress or trauma, increased experience of pain, postpartum urine retention or bladder distension immediately after birth, pelvic floor dysfunction, including fecal incontinence and urinary incontinence, pain with sex, and increased risk for vaginal tearing. Also, the procedure may not work, in which case a cesarean will be required. Vacuum came into play a little bit later than forceps did. It's basically a tool that's used to expedite delivery in the case of an emergency. There's a suction cup-like device that's placed on the top of baby's head, and suction helps pull them out of the birth canal at the same time as the person birthing is pushing. The risks to the baby include trauma to the tissues of the baby's head, face, eyes, or shoulders, broken blood vessels over the baby's eyes. There have been reports of fatal birth trauma to the newborn. There is a risk of accumulation of blood between the skull and the skin of the baby's head, swelling to the baby's head or cephalohematoma, and facial nerve palsies.